Hello and welcome. Today we'll be exploring Turner syndrome, a genetic condition that primarily affects females. We'll delve into its causes, how it impacts the body, its common signs and symptoms, how it's diagnosed, treated, and much more. So, let's get started on understanding Turner syndrome. Turner syndrome isn't passed down from parents like some genetic conditions. Instead, it's usually caused by a random error during the formation of the egg or sperm, or early in fetal development. This error results in a female being born with only one normal X chromosome, rather than the usual two. Sometimes, a female has two X chromosomes, but one is incomplete or altered. Rarely, some cells may have the normal X chromosome pair, and other cells only have a single X chromosome. This is called mosaicism. The absence or alteration of the second X chromosome disrupts normal development. Specifically, it affects the development of various organs and systems. The most prominent effect is on the ovaries, often leading to premature ovarian failure, meaning the ovaries stop functioning at a young age. This results in a deficiency in estrogen production, crucial for female sexual development and bone health. The missing chromosome can also impact other areas, leading to characteristic physical features, heart defects, kidney problems, and an increased risk for certain medical conditions. Turner syndrome affects approximately 1 in every 2,000 to 500 female births worldwide. It occurs across all ethnic and racial groups. Because it's caused by a random genetic error, there are no known geographical or socioeconomic factors that significantly increase the risk of its occurrence. The signs and symptoms of Turner syndrome can vary significantly among individuals. Some are apparent at birth or during early childhood, while others may not become noticeable until puberty or even adulthood. Common features include short stature, often significantly shorter than other family members. Many individuals have a webbed neck, a broad chest with widely spaced nipples, and swollen hands and feet at birth. Heart defects, especially coarctation of the aorta or bicuspid aortic valve, are also common. As they grow, girls might experience delayed puberty, failure to develop breasts or menstrual periods, and infertility due to ovarian insufficiency. Other signs can include kidney abnormalities, learning difficulties, and a higher risk of hypothyroidism. Diagnosis often starts with recognizing the characteristic physical features, or during evaluation for delayed puberty. A definitive diagnosis is made through a karyotype test, a type of chromosome analysis that examines an individual's chromosomes. This test can identify the missing or altered X chromosome characteristic of Turner syndrome. Other tests, such as echocardiograms and kidney ultrasounds, may be performed to evaluate for associated heart and kidney problems. While there aren't specifically defined types of Turner syndrome in the same way we classify other diseases, we do recognize variations based on the chromosomal abnormality. The most common is monosomy X, where there is a complete absence of one X chromosome. Mosaicism, where some cells have a normal sex chromosome pair and others have just one X, represents another variation. Additionally, structural abnormalities of the X chromosome, such as deletions or ring chromosomes, can occur. The severity of symptoms can vary depending on the specific chromosomal arrangement. There is no cure for Turner syndrome, but various treatments can help manage the symptoms and improve quality of life. Growth hormone therapy, usually started in childhood, can help increase adult height. Estrogen replacement therapy is crucial to initiate puberty and maintain bone health. Management also includes regular monitoring for heart and kidney problems, treatment of any identified heart defects, and thyroid hormone replacement if hypothyroidism develops. Psychological support and educational assistance can help manage learning difficulties and promote emotional well-being. Unfortunately, there's no known way to prevent Turner syndrome, as it's typically caused by a random genetic error during early development. Prenatal testing, such as chorionic villus sampling or amniocentesis, can detect the condition before birth, allowing parents to prepare and seek appropriate medical care. The prognosis for individuals with Turner syndrome varies depending on the severity of associated health problems. With appropriate medical management, most individuals can lead relatively normal and productive lives. Regular monitoring for heart and kidney problems is crucial to prevent complications. Recent research focuses on understanding the genetic mechanisms underlying Turner syndrome and improving treatments for associated conditions. Studies are exploring optimal growth hormone dosing, strategies to preserve fertility, and interventions to mitigate cognitive challenges. Ongoing research is continuously refining our understanding and management of Turner syndrome, paving the way for improved outcomes for those affected.